bonjour, je tiens à remercier sincèrement l'Association pour la santé publique du Québec pour l'organisation de cet événement et pour l'invitation à participer à cet important espace de dialogue. Sorry for my terrible French, but well, I'm very grateful to be here. Thank you very much, Kim, Catherine, Gladys. You have been very patient about all the process that my organization is asking for in order to be here. And I can see Doug Repke, so we have the best expert in the world here also. So it's wonderful. I will read in English my presentation in order to try to adhere to my time frame. So sorry for that. I used to be more eloquent when I don't read, but so for the Pan American Health Organization, it is particularly important to support through technical cooperation, governments and civil society in strengthening alcohol health policies. So all this is about collaboration, governance, and political action. Okay. So well, we're about to launch a regional report based on the global report written by DAG. And what we have for the Americas is that we have 7.4 liters of pure alcohol per capita per year, and 2 liters for among drinkers aged 15 years and older. We have a prevalence of 60% of adults as drinkers, and 1/3 of them present heavy episodic drinking. And we can have 5% of the alcohol attributable fraction of all causes of disease and mortality in the Americas. So that leads us to almost 400,000 deaths attributable to alcohol each year in the Americas. In fact, in this report, we will be able to show you how it's cirrhosis, cancers, injuries by car crashes, violence, and intoxications, the main causes associated with alcohol intake in the Americas. And Canada has one of the highest prevalences of use and heavy episodic drinking in the region. So the burden of disease is particularly high among young people, and this is not an individual issue, as alcohol industry intends to make us believe. It is the result of permissive environments and insufficient policies. Governments, civil society, and WHO PAHO must act together. So alcohol-related harm in our region is preventable. So the SAFER strategy, it's about these 5 best buys posted by WHO. These are proven cost-effective measures available today. So the problem is not technical, the problem is political. I will talk about these 5 interventions as what we have by the information that we have in Canada. So in Canada, the strengthening restriction of availability. Canada has a strong regulatory control over alcohol availability. Good examples are provincial retail monopolies. Monopolies are the best practices in this matter. We have the example of Ontario and also of Quebec, and regulation of hours of sale and minimum legal drinking age. But there is an emerging risk, a gradual liberalization in supermarket sales, as it was said in the previous presentation. So we support you about the concern that Quebec alcohol control policies may be weakened following what was stated recently. And we have another new development, which is the non-alcohol or low alcohol drinking beverages. And we're very concerned because all these beverages, in fact, have a little of alcohol. There are no zero alcohol beverages. And as WHO has stated, we must work on acceptability, availability, and accessibility of these products. So, in advancing drinking driving countermeasures, Canada has one of the strongest systems globally. Good examples are the mandatory alcohol screening, random breathing testing, zero tolerance for young and novice drivers, and strict blood alcohol limits. About facilitate access to screening, brief interventions, and treatment, Canada has integrated alcohol interventions within its health systems. Good examples are screening tools such as audit in primary healthcare, public addiction services in most of the provinces, brief interventions and specialized treatment, and integration within broader mental health systems. In fact, I must tell you, I have a special appeal about Canada's programs. Since 20 years ago, I was part of the research team in the National University of Mexico, in which we adapted the Self-Change program by Mark and Linda Sobel in Canada to Mexican population. But we have a challenge. The challenge is uneven access across regions. About enforced bans and restrictions on advertising, sponsorship, and promotion, this is the weakest component in Canada. Good examples are provincial restrictions on content targeting minors and pilot initiatives such as alcohol warning labels in Yukon. But we have key limitations. No comprehensive ban on alcohol marketing, strong presence of sports sponsorship and digital marketing. And I'm inviting you on March 27. We will have a webinar about sports sponsorship and alcohol in the context of the next soccer World Cup. About raising prices through taxes, Canada applies multiple pricing policies with public health relevance. In fact, Canada has the highest tax policy in the region, and it's federal and provincial taxation, and has minimum unit pricing and indexation of alcohol taxes, which is very good. So as a strength, you have evidence of impact and reducing consumption, and the challenge is the political pressure against price increases. And in fact, we have in the Pan American Health Organization, we also have a health taxes team that could provide support about these consultations that you're mentioning. So SAFER in the region, SAFER in the Americas shows some progress, but there are disparities across its components. Greater development is seen in strengthening health systems responses, drink and driving measures, and alcohol availability, but we have significant gaps remain in marketing regulation and effective fiscal policies. So I must say it again, marketing, regulation, and taxation remain weak in our region. There is fragmentation, weak enforcement, and industry interference. This requires coordinated action. So I was very delighted to read the Canadian alcohol policy evaluation on Quebec and to see what Quebec is doing well. So it was wonderful to find that you have tax rates amongst the highest in Canada, off-premise minimum pricing for malt-based beverages, which includes beer, and that the Quebec alcohol regulator has this focus on protection of public interest, as well as this escalating administrative licensing suspensions and interlock programs. But we need to work on some other issues, like for example, there is no minimum pricing set for alcohol sold on premise, and off-premise minimum alcohol pricing only applies to malt-based beverages. That the level of population-based off-premise outlet density in Quebec is 6 times higher than recommended, and that Quebec permits alcohol home delivery, and there is no good system that requires proof of age identification, and that only 5% of off-premise retail outlets in Quebec are government-owned and run. So there's some things that we can work on about it. So key elements for the effective implementation of the SAFER package, we need to transition from partial implementation to effective implementation. And I must tell you, this is the main problem, I guess, in the world that can tell us the implementation of the policies. Sometimes we have the best laws, but they are not very good implemented. Adopt a comprehensive, SAFER approach. This means not only one measure, but the whole package. Strengthen lacking key policies, protect public policies from alcohol industry interference, and strengthen the interactional governance with health, finance sectors, transport, and justice, and improve the monitoring and information systems. So the problem is not lack of policies, but lack of enforcement. The problem is that we are lacking authorities' commitment and accountability. So that's why collaboration with civil society is key for accountability and monitoring of the implementation. So safer experiences, I have a couple of experiences on the region, but also, I have some examples from high-income communities, Nordic communities like Finland, Iceland, Norway, and Sweden. They have these alcohol consumption levels have declined, and nowadays they are among the lowest in the European Union. And why? Because they have some very good restrictions and comprehensive bans on alcohol advertising, high taxation and pricing, limitations on availability, and the state monopoly systems in a comprehensive way for retail sales. The state monopolies allow for direct regulation of access to alcohol by controlling points of sale, trading hours, and sales conditions, thereby reducing both physical availability and commercial pressure. Key features of this model include limiting the number of points of sale, restricting trading hours and days, strict age verification, and the absence of promotion discounts or marketing strategies. So we have the case, for example, of Chile, what we like the most about Chile is that there's any form of commercial or non-commercial advertising, direct or indirect, of alcoholic beverages in sports, including the promotion, communication, and recommendation or publicity of such beverages. And sports items intended for mass distribution such as jerseys and uniforms, as well as promotional objects linked to all types of sports activities, may not contain names, logos, or images of alcoholic beverages brands. Okay, so that's a very good policy here in the region. Another one is Peru. Peru has been implementing systematic screening using audit in primary healthcare and brief motivational interventions for alcohol and tobacco use, 1.6 million screenings, and 80,000 brief interventions per year. And Brazil has a historical alcohol tax reform, and it is expected that in April or May, government will decide between submitting to the Congress a draft ordinary law or enhancing a provisional measure. So the SAFER virtual course, well, you can check the code, and we have a virtual course in our campus about the SAFER strategy. We also have one about advocacy on alcohol policies. They're very good courses. I have studied them, so I can tell you they're very good. And what we're doing at PAJO, well, we're strengthening the key policies by technical assistance on alcohol policies, by the virtual campus, and in the development of regulatory frameworks with the states. We're trying to increase the capacity to have capacity development about training for decision makers on cost-effective policies, strengthening health services. We're designing the protocols for psychosocial interventions as well as pharmacological interventions, and working about the accessibility of medicines for alcohol disorders treatment. And we want to be clear. Implementation depends on countries and on political decisions, but we are here as a technical assistance to support them. So PAHO collaboration in Quebec can include technical dialogue and benchmarking as well. And well, in order to close, I repeat, we have a webinar about alcohol sponsorship on sport events on May 27. We firmly believe that collaboration between public authorities, civil society, and international organizations is essential to design, implement, and strengthen public health-oriented alcohol control policies. Finally, we reaffirm our commitment to supporting efforts aimed at protecting population health and reducing alcohol-related harm. We know what works, we have the tools, collaboration is essential, so this is about protecting lives. And thank you, and let's talk about this. Thank you very much.